This week is National Eating Disorders Awareness Week, and the theme this year is I Had No Idea. The goal is to raise awareness about the effects of eating disorders on individuals and families around the nation. And Dr. Gregory Jones, a licensed psychologist, is here to help us better understand eating disorders. Thank you very much for coming in.
Oh, you're very welcome.
How common are eating disorders?
Eating disorders actually impact about 24 million Americans. And of those, only about 10% will actually go and engage in getting treatment.
And that is because there's shame associated with these disorders?
There's shame, there's a lot of secrecy. So people are very private with the eating disorders. They don't want people to know about it, so a lot of binging might occur in private. People who are not eating much are gonna try to hide it, so it's very secretive and a lot of shame and guilt associated with it.
When we think of eating disorders, we think of anorexia, we think of bulimia. Are there some others that people need to know about?
One that has been newly classified in the DSM-5 is binge eating disorder. So binge eating disorder is eating essentially a large amount of food that is calorically rather intense and then not compensating for it like bulimia. So there's no over-exercising, there's no vomiting or laxatives. But a lot of it is used to kind of help regulate emotions. So a lot of emotional eating that turns into binge eating.
And what is the outcome of all that binge eating?
The outcome is often obesity, gaining a lot of weight, poor self-esteem, leading to sometimes depression and anxiety, or vice versa, depression and anxiety leading to binge eating to help manage it.
Sure. So if you're underweight or overweight, you still might have a problem and you just might need help.
Absolutely.
All right, so what are the warning signs so that loved ones, people around can recognize individuals who might be suffering?
Well, as I mentioned before, secrecy is going to be a big one. So, for example, with binge eating and bulimia, the binges are usually going to occur in private. So you might find signs around the home of like a lot of food that just has disappeared. The person may disappear after meals to a restroom.
Food is disappearing because they're getting rid of the food. They don't want to eat the food.
Correct.
Ah.
So if you wake up in the morning, you open your pantry, and all of a sudden there's a lot of food missing, sometimes you're going to see a sign that someone's been binging.
Very interesting. And so with bulimia, what are we seeing?
Bulimia, you're going to see, again, it's about emotional regulation, using it to help manage your feelings. So oftentimes the binge will be a result of some sort of emotion that comes up that's difficult to cope with. And the purge is oftentimes a way to alleviate the emotion and get rid of the guilt for the binge.
We hear about the purge being vomiting, self-induced vomiting, but it's not always that. Sometimes
Correct.
people over-exercise.
Yes. People may use laxatives, diuretics, and they also may over-exercise, which is one that often gets misdiagnosed, and people kind of go under the radar with it.
That probably is a pretty good way to conceal it because people think, oh, you're going to the gym, you're doing something that's good for your health, and you can justify it. However, it's over-exercising.
Correct, yeah. Exercise in moderation is wonderful for the body and the mind, but over-exercising can really lead to detrimental impact on your body and your mental health.
What groups are we seeing eating disorders affecting?
Eating disorders don't discriminate. Everyone is at risk for an eating disorder, every population. The ones that are largest on the rise right now you're going to see are men and also women who are elderly.
And what change has occurred to make this happen more frequently in those groups?
For example, with men, we're seeing the average model size shrinking down for males. So the average chest has shrunk down 2 sizes. So in the media, what is being shown as attractive is going to be more slender and slimmed down male versus the larger, more bulky built male. With elderly women, you're seeing sometimes things like such as grief reactions, where they may have lost a loved one and having difficulty dealing with those emotions. Sometimes they may turn more towards an anorexic behavior where they restrict their eating, and it helps, unfortunately, numb out the emotions and minimize the pain.
Right, so that they can regain that control in their life. Let's talk a little bit about how to deal with someone who might be suffering. How do you engage them and get them to seek the help that they might need?
It is really important to actually engage with them. Oftentimes people are scared that they're going to hurt the person's feelings, or the person may be mad at them. But the thing is, you have to realize eating disorders are the most deadly of all mental health concerns. 1 out of 7 people diagnosed with anorexia will actually die from complications with their eating disorder. So it's important to realize that you are dealing with someone that you care about's life. So it's important to intervene and encourage them to get treatment. Help them find a provider that can specialize within eating disorders, or looking at residential or day treatment programs that can really help focus the treatment, because eating disorders take a full team to treat. So it's really important to kind of push to get that treatment for them.
And it's important to know, too, that if eating disorders run in your family, you might have a higher risk.
Yes. So there's a genetic predisposition for eating disorders, just like other mental health concerns like depression and anxiety.
All right, Dr. Gregory Jones, and people can get in touch with you by going to drgregoryjones.com. Thanks so much.
Thank you very much.
And we want to remind you to follow us on Twitter today as we live tweet during the show and post behind-the-scenes photos. We are coming right back.